What if I told you that the most dangerous thing about high blood pressure after 60 isn't what your doctor tells you, but what never gets mentioned at all? Because for millions of older adults, the story is always the same. You sit in a quiet clinic, the cuff tightens around your arm, the machine beeps, and suddenly a number appears that feels like a verdict. 150, 160, sometimes even higher. And without much discussion, you're handed another prescription, another pill, another dose adjustment, and you walk out believing you've handled your blood pressure. Yet deep down, you still feel uneasy, still tired, still worried, because something doesn't add up. The truth, and this is not opinion, this is physiology, is that blood pressure drugs are designed to manage pressure, not repair the aging systems underneath it. And after age 60, those systems change dramatically. Arteries stiffen, nitric oxide production declines, sodium sensitivity increases, muscle mass decreases, and inflammation quietly rises, all of which push systolic blood pressure upward even when you do everything right. And here's the uncomfortable part many people don't want to hear. Medication alone often misses two foundational food-based factors that research consistently shows can lower systolic blood pressure by measurable margins, sometimes by as much as 10 to 15 points when used correctly, alongside medical care. And those two overlooked factors are potassium-rich whole foods and nitrate-containing vegetables, not supplements, not miracle powders, but real foods your grandparents would recognize. Let's slow down and talk about why this matters. Because systolic blood pressure, the top number, is the strongest predictor of stroke and heart attack risk in people over 60, more than cholesterol in many cases. And unlike younger bodies, older arteries don't bounce back easily once damaged, which means prevention is everything. Yet modern diets quietly work against seniors by being high in sodium and low in potassium, a combination that forces the kidneys to retain fluid, increases vascular tension, and keeps systolic pressure elevated no matter how many pills you swallow. And this is where the first food comes in. Potassium-dense foods like beans, lentils, spinach, and yogurt, which research from large population studies has shown help relax vascular walls, counterbalance sodium, and reduce pressure inside the arteries. Not overnight, not magically, but steadily, safely, and measurably over weeks. And before anyone panics, no, this does not mean stopping your medication or treating yourself. It means supporting your body in a way drugs alone cannot, especially after 60, when potassium requirements increase, but intake often drops due to appetite changes or fear of certain foods. The second food category is even more misunderstood. Natural nitrate-rich vegetables, like beets and leafy greens, which the body converts into nitric oxide, a molecule so critical to vascular health that its decline is directly linked to rising systolic blood pressure with age. And studies in older adults have shown that consistent intake of these vegetables can improve arterial flexibility and lower systolic readings by double digits in some individuals. Again, not hype, not a guarantee, but a documented physiological response that complements medical treatment rather than replacing it. And this is where many seniors make a tragic mistake. They assume if something is simple, it can't be powerful. Yet the body does not care about complexity, it cares about chemistry. And chemistry responds to what you eat every single day. Now, if you're still listening, pause for a moment and ask yourself an honest question. How many years have you focused only on pills while ignoring the daily signals you send your blood vessels through food, hydration, and timing? Because blood pressure is not just a number, it's a reflection of how hard your heart must work every second you are alive. And after 60, every unnecessary strain matters. This is why some people see improvement without changing their medication dose, while others keep escalating doses with diminishing returns, and no one explains why. If this information already feels eye-opening, take a second right now before you forget and gently tap the like button, because it helps this message reach other seniors who are quietly struggling with the same fear you felt. And consider subscribing, not for hype, but for clear, evidence-based explanations designed specifically for aging bodies. coming back to the science, it's important to be clear and responsible. Potassium-rich foods and nitrate-containing vegetables are not cures, they are tools. And like any tool, they must be used correctly, especially if you have kidney disease or are on certain medications, which is why informed discussion with your healthcare provider matters. But ignoring these foods entirely is not safe. It's often harmful because it leaves a gap that medication cannot fill on its own. And that gap grows wider with every decade of life. Think about it this way. Blood pressure drugs lower pressure by altering hormonal or vascular signals, while these foods improve the physical condition of the vessels themselves. And when those two approaches work together, the results are often more stable, more sustainable, and more protective against sudden spikes that lead to emergencies. The real tragedy is that many seniors only learn this after a scare, a mini stroke, a hospital visit, a moment that changes how they see their own mortality. When the truth is, much of that risk could have been reduced earlier with better information and consistent habits. So, if you're over 60 and you've been told this is just aging, understand this clearly. Aging explains risk, it does not excuse neglect, and your blood vessels are responding right now to what you eat, how you move, how you breathe, and how informed you are, whether anyone talks about it or not. This is not about fear, it's about awareness, because awareness gives you leverage, and leverage gives you time, independence, and peace of mind. If this message challenged what you thought you knew, share it with someone you care about, because high blood pressure doesn't announce itself loudly until it's too late, and the more people understand what drugs miss without rejecting them, the better our chances of aging with strength instead of anxiety. And once again, if you want more clear, senior-focused health guidance grounded in real physiology, hit subscribe, stay with us, and remember, your age is not the enemy. Ignorance is, and the moment you learn differently, your future quietly starts to change.